Hey everyone, welcome back to the Mass Retirees Weekly Update. Today's Friday, May 5th. I'm Sean Duhamel. Thank you so much for joining with us and tuning in again this week. Now, before I get rolling with the week's news, let me first remind everybody that we've got a couple of upcoming Mass Retirees area meetings that you might be interested in attending. First and foremost, today at 11 a.m., today being Friday at 11 a.m., we will be holding our Boston area meeting at Florian Hall in Dorchester, located at 55 Hallett Street. It's right off of the Southeast Expressway, plenty of parking, great location. Florian Hall, for those of you who don't know, is the home of Boston Firefighters Local 718, so we very much appreciate them making their headquarters available to us. Thank you so much for our friends at Local 718. So if you are in and around the greater Boston area today, if you live in Quincy or Milton or Randolph or Braintree, Weymouth, come on up. You're not that far out. 11 a.m., you're going to miss the morning commute into town, and we promise to have you back on the road by 1 o'clock, so you'll miss the afternoon rush hour. However, these days with remote work and everyone's schedules being upended, there really is no rhyme or reason for the traffic. But in any event, 2 weeks from today, on Friday, May 19th, we will be up on the North Shore for our North Shore area meeting. We will be at the Marriott Peabody, right off the expressway in Peabody at our traditional location. It was actually the very first area meeting that we held post-pandemic, was last spring at the Peabody Marriott, and we're happy to be there again this week or this month. And then, of course, in June, we'll be down on Cape Cod in Hyannis for our first Cape area meeting since 2019. So attendance at our area meetings is beginning to pick back up. We're not quite where we were pre-pandemic, but we're getting there. The locations that we typically hold these events at are easy to get into, easy out, plenty of parking. There's plenty of space, plenty of ventilation, so members can feel safe to be able to attend. And it is a great way for us to meet you in person and talk one-on-one and have you get to know us a little bit and us to get to know you. And if you have any personal questions or anything that's going on related to your retirement or your health insurance benefits, it's a great opportunity for you to come in and speak with us personally about it, in addition to being able to reach us on the phone or an email and so forth. So we're excited to get back out there. We're looking forward to seeing all of you. And remember, if you do attend, our meetings are open to all Mass Retirees members, and you're more than welcome to bring a guest. We have light refreshments are served, and at the end of the meeting, we always have a cash door prize. 5 or 6 different names are pulled out of the hat, and we have cash door prizes for those members who stick around to the end of the meeting and stay for the whole thing. So with that, let me jump into the news of the week, and let me start a little bit talking about some news that came out of Beacon Hill this week. The April tax revenues numbers came out on Wednesday, and unfortunately, they weren't good news at all. The state is down in terms of the projected revenues for the month of April. We were down $1.4 billion over what had been projected. That's a 23% decline based on the budget projections for FY23, which of course is the current fiscal year we're in. Now, there's no reason to panic, as they say, both from economists as well as business leaders. 1 month does not make a trend. However, anytime you lose almost $1.5 billion in 1 month, it's a big deal. You know, there's no sugarcoating that. So state leaders are going to very closely monitor how things are going into May and, of course, in June as the current fiscal year comes to a close and we get into FY24. Now, the speculation over a slowing economy and the potential for a reduction in tax revenues coming in, state leaders have been concerned about this for many months now. As a matter of fact, when we were meeting with the House leadership over the course of the winter and into the early spring to talk about the state and teacher COLA benefit, the prospect of declining state tax revenues was brought up as a point of conversation. It was something that the House leadership and the Senate leadership and Governor Healy and her team are all concerned about, and they were all watching to see what was going to happen in April. And that was part of the reason why the House chose not to move forward as part of the budget with the increase in the state and teacher COLA base. As disappointing as that decision was, because of course we would love to raise the COLA base for state and teacher retirees. It's been 12 years, as all of you know, and as the House leadership plainly told us, what we're looking for is not unreasonable. However, at the end of the day, the money needs to be there to pay for these benefits, whether it's coming out of the retirement system based on the investment returns, or a combination of also utilizing the state budget to increase the appropriation. The law requires that all retirement benefits have to be paid for and funded, and we need a funding schedule. It doesn't work like Social Security or the federal government, where everything is simply pay as you go. Our system here in Massachusetts and within the other states around the country, everyone needs to have a balanced budget. Everybody has to pay for these benefits as the bill is due. So that's the challenge we face. The tax revenue news makes that hurdle a little bit higher for us, but we're going to continue to work to increase the state and teacher COLA base throughout this year. Our hopes are that we can get this done for the upcoming fiscal year, if not during the current legislative session. Now, the good news is that while state tax revenues have declined, we have certainly seen a recovery and an uptick with the pension investment gains. The first quarter of this year, so January, February, March, the PRIT fund, which invests all of the state and teacher pension assets, along with about 75 or so local retirement systems, also participate in the PRIT fund for investing the lion's share of their local pension investments. The PRIT fund returned approximately a 3.7% return for the first quarter. Now, while we don't have the exact numbers for the month of April just yet, by all indications, April was also a positive month. So far for the first 4 months of 2023, the investment gains have been all positive. And if you annualize those gains for the full course of 2023, over 12 months, those gains would be in the double digits. Now, of course, no one can predict the future. There are a lot of sort of warning signs on the horizon from the need to increase the budget cap at the federal level, and the deadline to do that is quickly coming up. And if we don't have the money on hand to pay our bills, that could cause serious financial ramifications. So hopefully that issue will be resolved going forward. But again, there's no crystal ball. All you can do is anticipate and make informed decisions. But the good news is that for the first 4 months of 2023, the investment returns have been very strong, and hopefully that will continue. And that makes it a lot easier, both at the state level as well as at the local level, for us to be able to successfully advocate to increase or improve COLA benefits and other pension benefits as well, because again, the money has to be there. And if the pension system's doing well, as we're seeing at the local level right now, with the great success that continues, whether it be increasing the COLA base for municipal retirees or adopting the additional 2% COLA for FY23, more and more systems on a week-by-week basis are doing the right thing for their local retirees and increasing those benefits. Now, while we're very optimistic on the pension side of things going forward, and remember that even if, worst case scenario, the economy goes into a recession and tough times are ahead, your pension benefits are safe. Nothing can be taken away from you. Any COLAs that you have received over the years become a permanent part of your pension. None of that can be changed or taken away from you. But our concern is always on the health insurance side of things, because when budgets get tight and cuts are needed, oftentimes we find that both public retiree as well as active employee health insurance benefits are in the center of the bullseye. We don't have the same legal protections when it comes to your health insurance benefits as we do on the pension side of things. So keeping that in mind, it's always wise to hope for the best, prepare for the worst. You're going to see in the coming months that we're going to be spending a lot of time working with our local public employee committee members, the so-called PEC representatives. Every city and town that implements certain changes to your local health insurance benefits has to establish what's known as a PEC committee, a public employee committee, and Mass Retirees under state law appoints the local retiree representative to represent all local retirees on these various PEC committees. So about a month ago, we convened a virtual Zoom meeting of our PEC representatives. We are now working with our friends from the teacher unions and the firefighters and the other public employee unions, along with Blue Cross Blue Shield, with the thought of potentially putting together an in-person meeting for our PEC representatives, not just the retirees, but also the union representatives, perhaps into the early fall. And the reason for doing this is really twofold. We want to make sure that our local health insurance representatives have all of the facts and the tools and the information that they need to represent all of you to the best of their ability. We also want to make sure that if the economy does, in fact, take a downturn, and if any types of even hints of reductions in benefits or cost shifting is even being considered out there, we want to make sure that we get out in front of that we're well prepared, and that we can collectively do everything we need to do to protect both retirees as well as active public employees from any type of unnecessary or unfair reductions. Now, one of the tools that we believe should be utilized to help reduce costs, not just for cities and towns and the state, but also for retirees themselves, is the implementation of what's known as the Medicare buy-in program. And the Medicare buy-in program is something that we have been talking about very frequently in the newsletter, on these weekly videos, in our teletown hall meetings. And under this program, retirees who are not currently Medicare eligible because you didn't earn your 40 quarters under Medicare and you don't qualify for Medicare because of that, even though you may be 65 and older, under the state system right now, under the GIC, we have about 10,000 retirees who fit that criteria, who are 65 or older, but do not qualify for Medicare. And these retirees are part of the active employee or under 65 retiree health insurance plans, which tend to be a lot more expensive, particularly in the case of copayments and deductibles. So under the Medicare buy-in, it allows the state or cities and towns to buy their way into Medicare on behalf of their non-Medicare eligible retirees. And in doing so, the government would pick up any late enrollment penalties or other additional fees that might be charged by the federal government to buy your way into Medicare. And even in doing so, even though the state or the cities and towns would be absorbing those additional costs, the savings, because you're part of Medicare and the federal government's picking up the majority of the costs of Medicare, it is a huge cost savings for both the government as well as the retiree. Out-of-pocket costs tend to be a lot lower, premiums tend to be lower, and it's really a win-win across the board, and it's really one of those rare instances where everybody benefits. Now, as you've probably read in the newsletter, we have a growing number of municipalities here in Massachusetts who have chosen on their own to implement a Medicare buy-in at the local level, and this has really been spearheaded and driven by our friends at Blue Cross Blue Shield in conjunction with Maya, which of course is the purchasing group that is part of the Mass Municipal Association. They provide Blue Cross benefits to 150, 160 smaller communities and school districts across the state, and they do a fantastic job. But between Blue Cross and Maya, they now have several dozen local municipalities who have enrolled their non-Medicare retirees into Medicare. Now, we are actively pushing the Group Insurance Commission and in constant conversation with them to do so at the state level. Unfortunately, it's a larger undertaking for the state because, as I said a moment ago, we're looking at about 10,000 retirees that would need to be enrolled in Medicare through this process, and of course that requires a lot of work. And the GIC, because of the procurement process that was just recently completed and open enrollment that was completed just this Wednesday, the GIC has not had the capacity over the past year to 18 months to move forward with Medicare buy-in. However, we're hoping that now that those other larger projects are behind them, a thing of the past, that as we move into the summer and into the early fall, that this might be something that the GIC can pursue, with the goal of beginning to enroll retirees in Medicare by the beginning of 2024, which is the next opportunity when Medicare enrollment would be open. Even if the GIC were to choose to move forward today, the federal government won't allow that group of retirees to begin to receive Medicare benefits until, at the very earliest, January of 2024. So that's what we're working on. It is a huge priority for us to move forward with this. We'll be providing more information to all of you, whether you're a municipal retiree or if you're a GIC enrollee. As we learn more, we're going to certainly be reporting on it. Now, as I said a moment ago, GIC open enrollment wrapped up this past Wednesday on the 3rd. It was a huge undertaking. There was some bumps in the road along the way. The GIC just launched their new membership portal that they encouraged both retirees and active employees to utilize to make any kind of changes to your benefit selection. And like any new technology, there's going to be ups and downs and some bumps in the road, so to speak, in utilizing that service. But the GIC will learn from that. We're working with them. We're in constant communication with the GIC leadership, and we're confident that that process will improve going forward, and hopefully going into FY25, that open enrollment process, things will be a little bit smoother. Now, we have been receiving some calls from our members who live full-time outside of Massachusetts or outside of New England and will be required to be part of the new Harvard Pilgrim Access America plan. For those of you who are GIC enrollees who live outside of the New England area, this is the only plan that's available to you. It used to be, or currently is, the Unicare Basic Plan. That plan is being replaced by Harvard Pilgrim for the next fiscal year. And we have heard from some members who are concerned that their local doctor or hospital or other medical providers might not accept this new insurance. Well, the question you need to ask your local provider is simple. Do they accept the United Healthcare network? Are they part of the United Healthcare network? Most doctors and hospitals and other medical providers outside of New England are not going to be aware of Harvard Pilgrim. They most likely will never have heard of Harvard Pilgrim before. But everyone's heard of United Healthcare. They're arguably the largest health insurance provider in the whole country. They have a very vast network around the country, and Harvard Pilgrim has partnered with United Healthcare to utilize their national network for this new benefit for GIC enrollees. So if you run into a problem that your doctor or your hospital is not part of the United Healthcare network, let us know. We will put you in touch with representatives from Harvard Pilgrim who are already working with a handful of members who have run into this problem. They're trying to address it with their physicians to get those physicians into the network. But it is a work in progress. I apologize in advance to anyone who's going through this. The last thing you want to do is have this type of upheaval when it comes to your health care. But we're going to do everything we can to work with the GIC as well as Harvard Pilgrim to make this as smooth as a transition as possible. Now, one last thing about Harvard Pilgrim. As some of you may know, about 2 weeks ago, it was discovered that Harvard Pilgrim was the victim of a cyber attack, a so-called ransomware attack, where some outside bad actor gained access to the Harvard Pilgrim network. That caused Harvard Pilgrim to shut down their entire computer system. So their phones, their website, any type of interaction with patients or doctors or other providers, all of that was shut down. And to a large degree, it remains shut down, at least as of today. Now, in today's email, we provide a link to a statement on the Harvard Pilgrim website. That is all the information that we have available. Things are very much a work in progress. From what we understand, the hope is that the infiltrators did not gain access or somehow compromise patient data. But Harvard Pilgrim, as far as we understand, is working with cybersecurity experts and other information technology experts to confirm that that is the case and take steps to get their systems back online and hopefully prevent this type of thing from ever happening again. But with every passing week, we hear more and more reports, not just from here in Massachusetts, but really around the world, of cyber attacks and these so-called ransomware attacks taking place. And it's unfortunately just a sign of the times that we're living in. So with that, let me sign off for today. Thank you so much again for tuning in. Remember, if you are in the Boston area today on Friday or up in the Peabody area in 2 weeks, come on by, say hello at our area meeting. It would be great to see you in person. In the meantime, everyone take care. Happy Cinco de Mayo, and we'll talk to you again soon. Bye-bye.